This conference will now be recorded.
Hello, good afternoon. Today I will be presenting a quick, concise, and what we hope to be a very valuable topic titled Antibiotic Stewardship, the 7 Core Elements. It is created and presented by Great Plains Quality Innovation Network. Content created by Stephanie Meduna, QI Advisor, recorded by Jennifer Everson, QI Advisor. Today's objectives include name the core elements of an antibiotic stewardship program, otherwise known as an ASP. Describe important goals of an antibiotic stewardship program. Describe the team members to include in your program. And discuss potential stewardship interventions in the long-term care setting. An antibiotic stewardship program is a program to improve the use of antibiotics in healthcare. The Centers for Disease Control and Prevention, the CDC, is working to promote appropriate antibiotic use by helping prescribers use the right antibiotic at the right dose for the right duration at the right time and ultimately reduce unnecessary antibiotic use. Improving the way we prescribe and use antibiotics, or antibiotic stewardship, is critical to effectively treat infections, protect residents from harms caused by unnecessary antibiotic use, and combat antibiotic resistance. Antibiotic stewardship refers to a set of commitments and actions designed to optimize the treatment of infections while reducing the adverse events associated with antibiotic use. The CDC recommends that all nursing homes take steps to improve antibiotic prescribing practices and reduce inappropriate use. The CDC has outlined 7 core elements which are necessary for implementing successful ASPs. Nursing homes are encouraged to work in a stepwise fashion, implementing 1 or 2 activities to start and gradually adding new strategies from each element over time. Any action taken to improve antibiotic use is expected to reduce adverse events, prevent emergence of resistance, and lead to better outcomes for residents in this setting. Before we review the 7 core elements, let's talk a little bit about why we need to implement an antibiotic stewardship program. Antibiotics are among the most frequently prescribed medications in nursing homes, with up to 70% of nursing home residents receiving antibiotics during a given year. Of those, 75% of antibiotics prescribed in a nursing home are considered inappropriate or unnecessary. Antibiotics can cause consequences and side effects in our residents, such as allergic reactions, kidney and liver damage, loss of appetite, and diarrhea. When we hear diarrhea during or after antibiotic use, we have to think about C. diff as a possible side effect. C. diff infections are the most common and sometimes fatal cause of antibiotic-related acute diarrhea in nursing homes. The increased risk of colonization or development of an antibiotic-resistant bacteria poses a risk for transmission to other residents. These are just some of the side effects that residents can experience from antibiotic exposure, so it's best to avoid these powerful medications when they are not necessary. Antibiotic stewardship can help prevent some of these consequences and protect the residents in your facility. The CDC has come up with 7 core elements to ensure a successful antibiotic stewardship program. The 7 elements are leadership commitment, accountability, drug expertise, action, tracking, reporting, and education. The CDC also has a core elements checklist you can use while putting your antibiotic stewardship program together. And at the bottom of the slide, there's a link out to that checklist. We will now touch on each one of the core elements in a little more depth. The first core element is leadership commitment. Demonstrate support and commitment to safe and and appropriate antibiotic use in your facility. Facility leaders can show their support or buy-in by writing statements of commitment to show they are in favor of improving antibiotic use, which can be shared with staff, residents, and families to promote the antibiotic stewardship program. We've all worked with those families that can state the last time mom or dad were acting like this, they had a UTI. Can we call the doctor and have an antibiotic started? The buy-in of leadership will help with the buy-in of families to not always request an antibiotic. Ensure the medical doctor, clinical nurse leads, and consultant pharmacies know their parts. Communication throughout antibiotic stewardship will be needed. You will need to communicate with nurses, prescribing clinicians about the expectation of the use of antibiotics. Create a culture by educating, promoting, and celebrating improvements so staff are empowered to help with the next resident who may be started on antibiotics. The second core element is accountability. Nursing homes need to identify the staff who will be accountable for the stewardship activities. The medical director will be responsible to review the standards for all the other clinicians who provide care within the nursing home. They are not only responsible for the data, but they also have to ensure best practices are being followed. The director of nursing will set the practice standards for assessing, monitoring, and communication changes in the resident's condition. The nurses and nurses' aides are the frontline decision makers for starting an antibiotic. The way the resident's condition is relayed to the physician can influence the use of antibiotics. Therefore, the importance of antibiotic stewardship needs to be supported by the nursing leadership. Use the consulting pharmacist for your facility to help with the type of antibiotics and reporting of antibiotic use. The infection preventions can be used to monitor and support antibiotic stewardship activities. The IP may monitor antibiotic starts, antibiotic resistance patterns, and adherence to evidence-based practices like following the McGear's criteria or the Loeb's minimum criteria. It is important for the IP to have training, dedicated time, and resources to collect and analyze surveillance data. The laboratory whom the specimen was sent to can also be utilized to identify specimens and may also provide an antibiogram. The state and health departments may also be of help. The third core element is drug expertise. The consulting pharmacist likely has had some training with antibiotic stewardship. If not, here are a few links you can provide to your consulting pharmacist to review. The local hospital infection preventionist is also a great resource to use, as you likely have some of the same residents you are caring for. You can also network with other facilities to help answer questions. Developing relationships with other infection preventionists or disease consultants can only help with your antibiotic stewardship program. I know some of us live in smaller cities and don't have access to many resources. That is why networking outside of your facility is so important. The fourth core element is action. Policies which support your antibiotic stewardship is very important in order to change the practices of antibiotic use. The process should be taken slow so the staff are able to become familiar with the process and not be overwhelmed. You may want to prioritize the interventions which will likely make the biggest impact and then work on the others over time. Using the S-bar communication tool when communicating with a physician may help ensure the assessment is relayed appropriately. A review process known as an antibiotic timeout will give the physician an update to ensure antibiotics need to be continued or could they potentially be stopped. In addition, a review of any culture results can be completed to ensure the resident is on the correct antibiotic. The pharmacist can play an important part and help guide the provider to be sure the correct antibiotics are prescribed. It is key to identify clinical situations which may be driving inappropriate courses of antibiotics. The fifth core element is tracking. Nursing homes will need to track and trend at least one process measure of antibiotic use and at least one outcome from antibiotic use in your facility. Antibiotic process measures track how and why antibiotics are prescribed. Antibiotic use measures track how often and how many antibiotics are prescribed. And antibiotic outcome measures track the adverse outcomes and costs from antibiotics, such as rates of C. diff infections. The sixth core element is reporting. The data collected and feedback on the ASP should be reported back to the antibiotic stewardship team. The team can discuss progress and make adjustments to the ASP as needed. The seventh core element is education. The education will keep a robust antibiotic stewardship program going. Nurses and physicians need to know the goals and what their responsibility is. This can be done at staff meetings. Physicians can be given monthly or quarterly report cards which show how they compare to their colleagues or show if the overall goal is being met. Residents need to be aware of the antibiotic stewardship program, as do the families of those residents. If both residents and families are aware of the goals, it may help the physician from starting an unnecessary antibiotic. Information can be relayed to residents via charts in the building or in a nursing home newsletter if you have one. Showing improvement and educating the residents and families about the decrease in the number of adverse events or the decreased number of days of therapy may be an eye-opener for them. Remember, we have gotten into an antibiotic crisis by prescribing and requesting antibiotics for every little sniffle time and time again. The culture needs to change to help turn this crisis around. The use of the 7 core elements can be applied to both nursing home and hospital antibiotic stewardship programs. Working as a team is crucial, not only with the providers and nurses, but also with the consulting pharmacists, local hospitals, and the Department of Health. Your commitment will help protect your residents and improve clinical care in your nursing home. We appreciate you taking the time to listen and learn from this presentation. We wish you good luck with your ASP. Here are a couple resources that may be helpful to you in getting your ASP started. Again, thank you for your time, and I wanted to leave you with Stephanie's contact information. If you have any questions or need any support in creating or maintaining your ASP, please don't hesitate to reach out.